I think you can all see my slide now. Today I'll be talking to you about medical diplomacy. Right now we hear quite often about the terms, but I also want to bring a longer time perspective in this topic. Therefore, we'll be talking about medical diplomacy before and after COVID, and in particular, drawing on Chinese engagements in Zambia. I'm here today, but I'm actually speaking also on behalf of Peter Schumacher. He's one of my PhD who actually, did the field work, and this belonged to actually his PhD research. But he cannot be here today, so I'm speaking on his behalf, and hopefully I will do justice as well. So let me go ahead. As said, no, we are now in a time when every day we hear about COVID and vaccine and so on. So this is, of course, in this audience, nothing new. That we know that China is very active in, these sort of pandemic in, not only dealing with situation at home, but also panning out its involvement engagements worldwide. So this particular clip I've got from the newspaper, showing how China deploys the vaccine to build influence. So very often we hear this connection, right? That how Beijing is assembling, is orchestrating really various partners, also a lot of commercial partners, China, also early on, the Chinese diaspora, and moving around things, and in a way, sort of engaging in this pandemic world. We might be easily thinking away something that is something new, that COVID, provides a stage for the Chinese state to engage in a certain way. But this actually can be seen as sort of just an intensification of a project that probably a lot of you also are aware of, this so-called Health Silk Road initiative, was introduced in 2015 for the first time. The term was used, and it is of course relatively new, but lots of course also have happened. So I just want to contextualize this idea of these mass diplomacy, vaccine diplomacy, not as something that is sort of a result only of COVID-19, but it is part of a longer project that has been actually going on for some years now. No, the Health Silk Road project is, can be said is relatively new. It started 2015, and just just last year, half a year ago, there was this bigger paper from the Chinese State Council, writing Fighting COVID-19, China in Action, and there's a lot of things in these documents, focusing also on the domestic policies and initiatives, but there's a big section also on building a global community of health for all. So in that particular segment also very clearly lays out the Chinese ambition and plan in coming out from COVID and how that connects to its broader China Silk Road, the Health Silk Road initiative. But I want to take us even more into historical time. This so-called health or medical diplomacy is actually not so new. It's also not something from 2015. China has been involved in the medical sector as part of its sort of aid, apparatus for some decades already, really. It started in the first well-cited first engagement to Algeria, and the setup is, till recently, it's about Beijing sending Chinese medical teams, CMT, to places, partner countries where they see that there is a need for China to engage. So the first actually team, CMT team sent to Africa was took place already in 1963. No, so we should actually contextualize these, Health Silk Road project as, in this historical perspective as well. As you all know, in the 60s, just like other aid engagements, China was, putting aid and support and other kind of cooperation, development cooperation activities, to countries selectively, of course, to court newly independent African state. So that was a very important part of the political project internationally. So this is just to kick off, to make us think about, okay, that in Africa since the 60s already, there have been health and medical diplomacy initiatives, and in different countries there have been, of course, different trajectory. And as I said to you today, I will be speaking from our research in Zambia, and when Peter and we planned this research, and when he did his field work in the field, it was before COVID time. So we were actually choosing some segments in the Chinese-Zambian partnership to study. That was sort of not to say sideline, but was not attracting so much attention. I'll get to the project detail a little bit later, but I just want to let you know that what I'm presenting today comes from this paper that we published already a couple of years ago, and it's a paper that I actually wanted to present to you in the face-to-face conference earlier, which was cancelled. And this paper, we would be looking, we write quite a bit about, from the looking at knowledge, mobility, immobility, and really showing the grounded experience. I'll come to more details about our own research in a little bit, but I just want to show you, if today I also add some of the new things that I'm thinking about in the paper, so I won't have a lot of time for many details, but if you're interested, that's where the paper is. So bringing our lens, into Zambia, of course, Zambia is one of the important partner countries for China, and in the medical field, there have been Chinese medical teams sent over. There have been also building of Chinese-funded hospitals. So quite interesting, because some of these hospitals are, so-called these friendship hospitals. For instance, this particular in Lusaka was built, and it's a big modern one. But the building of these new hospitals sometimes also mean the erasure of older ones. As said, the partnership has been for much longer, and sometimes the construction of new modern hospitals might also mean the relocation of resources from maybe more peripheral areas. So as a geographer, we always think, how to bring these stories really onto the ground and see how, some of these attention-seeking initiatives or investment might actually have impact on other places, other communities that is now decentered, so to say. But anyway, those are some of the observations we have also made when we're doing our field work. Our paper is really about what happened on the ground when medical teams, Chinese medical teams, working with local patients and local colleagues. And I did a little search because, as you all know, things in China and in Africa change so fast. So I was just looking at search and see what things are happening now since we did our research a couple of years ago. And then I found this film. It's only 2 minutes long, but I thought maybe we can watch it together, because that will also bring us to to be able to visualize, to see. And of course, this is a video shared by Xinhua. It was broadcasted in CGTN, so it has its perspective, but I think it helps us show, obviously, when we were doing our research, we didn't take photos and we didn't also film. So I thought this particular one can also bring us some, let me see, I hope I can do this. There's always the danger when I try to do these things. And I promised Castillo that I know this, I know how it works.
You're fine, take your time, take your time.
But I think if I show now.
Now, China has since the 1960s.
I don't think we can, I cannot see it. I don't know if, okay.
Yeah, I have to show it again.
Yeah.
Yes,
please.
Now I can do it.
Routinely sent medical teams to Africa to provide assistance to over 40 countries. Over 20,000 Chinese doctors have assisted in the continent's many health needs. Our reporter Li Chanhua visits a Chinese doctor who's wrapping up his time in Zambia's Levi Mwanawasa Hospital to find out what his daily routine is like.
It's the last day in Levi Mwanawasa Hospital for Chinese cardiologist Wang Weimin. It's also his last day in Zambia. Dr. Wang spent just over a year here. He routinely performed checkups and other procedures on patients in this cluttered, disorganized medical center. Due to the lack of funding, the hospital has only 150 beds, while the number of patients is overwhelming. Wang said the decision was not easy to make in the beginning.
To be completely honest, I did not know much about Zambia back then, including the epidemic here, harsh living environment and social security issues, and because of that, I did have much pressure when making the decision. But after talking to my family, I finally made the decision to come here.
On Wang's last day, he talked to the younger doctors about this and other issues, and he said he had a strong connection with the people here.
We have established a strong friendship with the local people over the past year, especially with our Zambian colleagues. Since China's reform and opening up in the 1970s, a large number of African students have studied medicine in China. Their studies in China have deepened their understanding of China and established strong ties.
Chief among those ties is his quoted Zambian daughter, a young doctor who studied in China for 5 years.
They are leaving and I feel so bad. It's like Zambia will lose out a lot because they were really helping us out. Yes. So I feel bad. And I'm hoping when they go back, they have a safe life there, happiness should be with them, and for them to come back here so that they should continue helping us.
Last day of 379 of them, like every other regular day, he checks up on his patients' cases, making sure everything is in order. Taking off his white gown, he puts the final touches on his 1 year in Zambia. In the meantime, the next batch of Chinese doctors are on their way as he leaves. Li Jianhua, CGTN, Lusaka, Zambia.
So it's just hopefully it shows, illustrate a little bit, what we are talking about. These doctors, the CMT, being sent to, so-called being sent to Zambia to work. So I'll bring it back to my PowerPoint here. Yeah, as said, this film was filmed by CGTN. It has its perspectives and its staging. Our research was conducted before 2018. It was we started in 2014, and Peter Schumacher was there for 4 times over. Altogether around over a year between 2014 and 2016. It's important, of course, as things change very quickly in the settings. So What is it? It's as I told you, it's a part of his PhD research. It is part of a broader research, and the broader aim of the research is to study mobility flows, the geography and impact of mobility flows between Zambia and China. It aimed to go beyond the standard narratives. Some of you might already immediately think, oh yeah, Chinese in Zambia is about the copper and coal mines. It's about these big infrastructural investments, real estate, etc. But we were hoping, to go beyond those narratives, and also to uncover grounded and lived experiences of the Chinese and Zambians engaged in transnational mobility fields. We did closer study of 3 different fields, or 3 case studies, you might say. One is on student mobility, and here mainly on Zambian students who study in China, a lot of them also medical students who have then also returned to Zambia. And the second case study is in the agricultural sector. So we also study private and public-private kind of partnership in agricultural sector. And the third one is on the medical sector, about the CMT. As a qualitative mixed method research, we also did some policy and media analysis, and it's funded by the Dutch Research Council. As said, the fieldwork was conducted mainly by Kate, and between 2014 and 2016. And here's some background that, as said, in Africa in the 60s already, there was this CMT sent to Algeria, in particular to Zambia. Chinese medical engagement started in 1978. And ever since then, there have been 21 batches of these CMTs who sent or arranged to go to work in Zambia. Excuse me. And there are a lot of numbers, and then that is also something that we write about. If you look at the public record, then they say, yes, the Chinese CMTs have treated millions of patients, carry out tens of thousands of operations, and so on. But it is also our research to try to go beyond these numbers to really see, especially looking at knowledge mobilities, what happened. During the COVID time, Zambia also like one of the many African partner countries, receive anti-epidemic goods already in April. And what's also interesting in this health Silk Road is the engagement, like other aid set up nowadays, that it's not only about the Chinese state sending state resources over. It's about Chinese state orchestrating. There are also other actors involved. The Jack Ma Foundation is has played a big role in this donation of COVID-related stuff all over Africa, but also a lot of companies. There's also commercial interest, a lot of things that is so-called donated or sold. There's like in other aspect of the current China aid practices. There's a lot of mixing between donation and what are being sold for commercial interests, etc. So here are some of the photos, very recent, how Zambia ambassador are thanking, as you see, that, friendship is very important. It's always in the narrative that, China is, in the pandemic time, China is the one who takes care of its friends. Probably good to see that as we speak. A couple of days ago, Zambia and China also had meetings and talk about more cooperation. A lot of this about, the big challenges facing Zambia, like many other African countries. And I just want to show the slide because we talk about COVID. Sometimes it's good to see where things are going, just like where we live in Europe. Every day we are looking at the numbers. And if you see now in February how the numbers of COVID in Zambia is actually rising very quickly. So it is about, a very, very dynamic situation. And I can imagine, like because of this, then engagement from China could intensify also, very soon. Here I'd like to show you our conceptual part. I don't have much time to go into it, but in our paper, how we want to engage is about knowledge mobility and co-production. Indeed, to go beyond looking at only the people, number of people, number of hospitals, number of operations, but these kind of medical exchanges often also is implied, right? By doing this, by sending Chinese doctors, there will be knowledge mobility, knowledge transfer usually is used as the term, and then to teach, you know, the African partners how to do things better. But we would like in our project to look at knowledge as more differentiated. You know, we draw on colleagues from Polanyi to Blacker to Alan Williams, who've looked at knowledge as, you know, that is classified as brain knowledge and cultural knowledge and body knowledge, and all these have different mobilities, have different filters, and you know, and we like to sort of deconstruct a bit, you know, how knowledge, and not to go beyond this thinking that yes, Chinese doctors go there and then, you know, they can just transfer the knowledge and development will take place. So basically to unpack all these concepts. And in this particular paper, we also draw on Peter Moisberger, and geographer's communication model. Here, he was using this model to look at how knowledge move or not. So how come some knowledge can diffuse, and how come knowledge can be acquired, and what are then—
Sorry, Maggie, you have two or three more minutes.
Oh, okay. What are then, you know, the filters, you know, that that block or, you know, mobilize knowledge? Yeah. So sorry about this rush at the end, but and then in this paper that we also then look at how, you know, different kinds of knowledge are mobile or less. What we have found out is that more technical, practical knowledges, you know, the cognitive knowledges with tools, actually, not only cognitive knowledge, because language is a problem. So, you know, hands-on stuff that, you know, colleagues need equipment, for example, in surgery, in X-ray. Those were the things that colleagues find that they, you know, they could actually pick up things from the Chinese colleagues quickly. And cultural knowledge experience more resistance or more friction. For example, when we were doing our interview, colleagues, the Zambian colleagues, for example, the physiotherapy said, yeah, you know, when they talk about Qi energy in relation to acupuncture, that sounds to me like a belief and not very scientific. So you see how on the ground, of course, you know, knowledges of different kinds is being also valued differently and being judged differently. Some are considered as scientific and can be picked up, and some are treated more with skepticism. Although things also change, you know, because I think acupuncture and Chinese medicine now is being promoted in a different way. Another big point that we have found out is the language barrier. I think that is not surprising to a lot of you. We have found that, you know, the key barrier for communication, knowledge, mobility is language. Most of the CMT doctors we have met spoke very little English, and oftentimes their service in Zambia, their duty in Zambia is the first time they've ever gone overseas. So as here it says, in our Zambian colleagues, you know, it said we waste the first 6 months to get to know each other, that, you know, to go be, you know, sort of go over the language barrier, and therefore time is very important. You know, when we were doing the research, DCMT were placed in Zambia for 2 years, and then it was reduced to 1 year at the end of our research time, and therefore that of course also has an impact on, you know, what knowledge transfer and mobility can take place. Expression of insecurity is a part that we found out that the Zambian colleagues also found it that because most of the Chinese colleagues were not very good in English. So in the beginning, there was a lot of these, because of lack of confidence, lack of security. So a lot of times communication was very difficult. And sometimes doctors were, you know, very well trained. They appear very shy and could not really, you know, perform. But the learning curve is very steep, as they said, and they really appreciate it. And in the narrative, we find a lot of evidence of these sort of power geometries, where definitely the directionality of knowledge flows was considered as one direction expected and performed. So so basically the Zambian colleagues will learn from the Chinese colleagues. Other than English, and when we talk to the Chinese doctors, they basically say, well, yeah, English I learned, and that's the part where I learned new knowledge, and HIV treatment. Those were the two narratives we have found after talking to, you know, quite some colleagues. Otherwise, they consider this at a time where they just work, and it's not about them gaining capacity, but it's about them training the other colleagues. And there's hierarchy in the profession where doctors and nurses the nurses didn't think that, they were even being part of this knowledge mobility construct, because nurses thought that they're doing little things. So that was that. And then we also realized, these, sometimes we say, it's China's providing a new model of development, new ideology. We find actually it's very much recycling a lot of this modernization, technological advancement equals to development. Zambian colleagues look at China as, the future, the model, because they have more machines, they have more capacity, and so on. I just want to end quickly about looking into the future. As mentioned in the film also, I think the landscape in the future will change quite, in different ways. Of course, doctors going to Zambia to work might pick up different social demographics. But also another big change is that there are a lot of Zambian students who have been studying medicine also in China. A large proportion of the current Zambian students studying China are medicine students, and that means that when they come back to Zambia, they would have studied medicine but also learned Chinese language. And so I think these filters that we call the prism of cultural and language blockade might change. There's a lot about that restructuring going on, and I think these are the discussion that beyond my paper, but I also think that is a very important part of the China-Africa relation, and how further on, the Chinese engagement will work. And at the end, we want to link our paper now to follow up to look at how, this new health diplomacy, how we understand its politics of generosity, some older concepts that we have used in international relation. And I think there's a lot to unfold. But in the interest of time, I'll stop here. But maybe here are some of the things that we can discuss later on, how COVID now will bring this health diplomacy into maybe a new era. Thank you very much for your attention. I look forward to your questions and comments.